Hello, my name is Delo, and today I'm going to show you the small volume nebulizer competency. So prior to going inside the patient's room, we are going to check the patient's chart and the physician's order. So we go on the patient's chart and then we check in the EMR the physician's order. So at this point, this patient is gonna get a small volume nebulizing treatment and a medication of Duponeb, which is consisted of albuterol and ipratropium bromide, and it comes in 2.5 milligrams. After that, I'm going to check the patient's chart. I'm going to check his vital signs for trending, the patient's chief complaint, why is this patient getting this treatment, and why is this patient getting Duponeb. So I'm also going to check if there's any sputum sample that's already been done, or any chest x-ray or anything like that. So after that, I'm going to gather all of my equipment. So I will be needing my small volume nebulizer, a mask just in case the patient doesn't want to take a mouthpiece treatment, and an extra tubing just in case the patient is away from the flow meter or the bed. I'm also going to need my medication, gloves, pulse oximeter, tissue just in case the patient needs to cough anything out, and then my stethoscope. So after that, I'm also going to bring an extra bag just in case this is the first nebulizing treatment that this patient is going to get. So I would get a Sharpie and a bag to for my small volume nebulizer to be put in after the treatment. So after that, I'm going to wash my hands, knock on the patient's room.
Yeah.
Hi, good evening, Mr. Perez. How are you feeling?
Good. Alright.
Alright.
Yeah.
Okay, so my name is Delo. I'm a respiratory student from Hartnell College, and I'm from the respiratory department, and I am here to give you a breathing treatment, okay?
Okay.
So, can you state your name and date of birth for me, please?
7/16/87, Daniel Perez.
Okay, let me just confirm that with your identifiers. Thank you. So, how severe do you feel your chest tightness? Is it super tight, or just tight enough that you can't really breathe?
Just feels like I got some stuff in there.
Oh, okay. Do you think you could cough up anything? Just try coughing here. Give it a strong cough, okay? Okay, I could hear that there's some gurglings in there, so he didn't have any sputum, so we'll just toss that one out. So, okay, I'm just gonna do your vital signs first before we move on into your treatment, okay? So this is just a pulse oximeter. It's just, this probe is just gonna go on your fingers, and it's just gonna read your heart rate and your saturation rate, okay? Saturation rate is just how much oxygen is binding to your hemoglobin, okay? Or your blood. So just plug it in. We also want to make sure that this probe is always constantly being cleaned every after patient use. So I'm also going to check the pulse just to make sure that it corresponds with the pulse that's on the monitor. It does. And at the same time, I could also check the heart rate through this and do it for 30 seconds and times it by 2. And at the same time, I could put my finger and his wrist on his chest area to check his respiratory rate. Check it for 30 seconds too, and multiply it by 2. Thank you, sir. So his respiratory rate is on 16 right now, which is still in the normal range, and the heart rate is 85, which is still in the normal range. And it says in here that it's an 83, so that's about um, about right on what I got from his pulse. And also, if the patient is a woman and doing this sometimes can be a little awkward for women versus a male, you know, taking it this position. So what we could do is we could just take the pulse in here and then watch the chest rise and the abdominal movement. Okay, I'm just gonna leave that probe in there, that way I could watch on your heart rate while giving you this medication. Okay,
Okay.
so you are getting a small volume nebulizing treatment today, and what it does is basically it aerolizes the liquid medication that we have in here, so you could breathe it in. Okay.
Okay.
So we have two kinds of nebulizer available. We have a normal small volume nebulizer, which just has a feature as continuous, and we have a breath actuated or aero eclipse, and this one has two features in it. On the dotted lines, on the dotted triangle, it's basically breath actuated, so the medication is just gonna be triggered by the patient's breath or inspiration, and this ball will go down every inspiration that the patient takes. And if we go into the solid triangle, it's gonna give a continuous medication, so you'll see a lot of mist coming out, as also for this one for continuous. So for this one, the patient is okay to do a breath actuated, so I'm going to put it on breath actuated. But if patient gets somehow trouble triggering a breath, we could just put it on continuous. So you're getting a duonev, which is consisted of ipratropium and albuterol, and this basically opens up your airway. It's called a bronchodilator. So your airway right now looks like this. Normally it looks like this. So what this medication does is it opens it up from this to going back to normal. That way we could hear, you could have more air going inside your lungs and breathing more normally. Okay, and some adverse effect on this one is you might feel a little jittery or some nervousness or some tremors, like when you drink a lot of coffee, that feeling that you get, that's what you're going to get on this one. But that's why I wanted to constantly monitor your saturation, your saturation and your heart rate, just to make sure that we could stop whenever you feel like you're having that adverse effect, or if I see that your heart rate is increasing way too much. Okay?
Okay.
So I'm just gonna put this in, and then so usually I have a bag. So I have a bag usually, so I'm going to put this first on my bag. Let's just pretend that there's a bag in there. It's on the bag. So sir, I would have you turn on the side. I'm just gonna auscultate your bag, okay? And we'll see if how's your air movement, okay? So listening to the breath sounds, we go systematically. So if we go on the left first, we go on the right second, we go top, then go back to left, top, and go back to right. So that's how we do auscultation. And we start from the basis, that way we catch those crackles first thing. Okay? So I'm gonna have to ask you to take a couple of deep breaths for me, okay? Deep breath for me. Deep breath. Deep breath. Deep breath. Deep breath. And one more. Okay. So We also want, okay, we're good, sir. Thank you so much. We also want to listen on the front. So again, we start from the basis, going to the top, and we do it systematically. And if the patient is a woman, we would ask for permission. Since we're males, we would ask them for permission if we could auscultate their front area. Okay, so just gonna lift up your gown. Deep breath. Deep breath. Deep breath. How are you feeling? Good. Deep breath. We're almost there. And last one. Good job. So right now, Mr. Press is having a little bit of wheezing inside his lungs. So we just have to confirm that, and we can confirm that by listening to the neck area, see if there's stridor. Good deep breath. Okay, so the neck area is clear, so the wheezing came from the insides. So this medication will actually help him. So dispensing the medication inside, we make sure that we don't touch anything from the inside of the canister. That way we don't contaminate it. There we go. I'm just gonna put it on continuous right now, since this is not an actual medication. And we put this on 8 liters per minute. Supposed to be good. There. So as you guys could see the mist in there. So breath actuated would look like this. So medication will not be coming out, and then continuous would come out. So this so this treatment runs at least 5 to all the way to 15 minutes, depending on how much the medication is in here, but it usually just runs up to 10 minutes. So we'll just see how the patient is going, and then monitor the heart rate and the saturation rate. So Mr. Perez, after 5 breaths, can you take a really deep breath for me, and then hold it for a couple of seconds, and then exhale. That way the medication will actually go down all the way to your basis and stay there. So let's just say that that this treatment already has been done. Okay, sir, thank you so much. You're done. How are you feeling?
A little better.
Little better? Okay. So I'm gonna do another auscultation on you, and then another vital signs, okay? So as I said earlier, we have a bag for the patient, and we always put the nebulizer in there. That way, if the patient needs another round of medication, the nebulizer is already set in there. So, sir, I'm gonna have you turn again on that side. And then let me know if you get dizzy from taking a lot of deep breaths, okay?
Okay.
Deep breath. Deep breath. Deep breath. Deep breath. Okay, we're almost there. Last one. Okay, roll over. Thank you. Then one more time, and your front. Start at the basis and be systematic. Deep breath. Deep breath. Deep breath. Deep breath. Okay, we're almost there. Deep breath. Last one. Very good. And then we'll listen one more time on the neck area, just in case. you, sir. So the medication did help Mr. Perez from wheezy and a little crackly from earlier. Now he sounds a little bit more wheezy, but more like diminished. So there's no adverse effect because the heart rate is 76, which is still in the normal range, which is fine, and his saturation is 98, which is much better than earlier. So thank you so much, sir. Then can I just ask you one more time to give me a really, really good cough, like a big, big cough? Okay, so there's none, so we'll just toss it again. Is there anything else I could do for you, sir?
Mhm.
Okay, so I just want to let you know that you have call button in here, and then on the other side, and you also have a call button in here. Wow, you have a lot of call buttons for the nurse. Just press that, and then you could just ask the nurse for me or any of the RT teams if you need any breathing treatment, and or if you feel really, really tight. Okay.
Okay.
Thank you so much, and I'll see you later.
Okay.
Okay, so after leaving the room, I'm going to wash my hands, sanitize my equipment, especially my pulse oximeter. That way it's ready to go for another patient, and then I'm going to document all of the things that I did for Mr. Perez. So I'm going to document his vital signs, pre and post, and then pre and post auscultation, and I'm also going to chart the medication that I just administered to him, and after that I'm just going to do another routine check on him. Thank you.